Thank you, Margaret. My question is on India. India is now on top of the list in terms of highest daily cases. How do you assess the situation in India? What do you make of the government's response? And are there any concerns with regard to India? Thank you.
Yes, India has a very high number of cases, but I think we should obviously see the number of cases in India today against the backdrop of the country's size and its massive population of 1.3 billion people. The cornerstone of the response is still the same no matter where you are. As of yesterday, there were over 1.75 million cases and over 37,000 deaths reported. India has done well on sampling. It's tested almost 20 million tests already, and does on average 500,000 tests per day. There's been a move in the last number of days and weeks to really expand testing and to allow a greater freedom for medical practitioners to request testing. So the approach to increasing that, the creation of a COVID diagnostic training centre as well, has also helping to expand the capacity to do testing. So clearly India is determined to expand its testing regime further and further afield. I believe the Ministry of Health is also importing extra oxygen concentrators and also really trying to leverage the over 43,000 health and wellness centres across the country to ensure the continuity of essential health services. Again, a focus, I think, working with WHO and with UNICEF on issuing a frontline health workers toolkit to really improve the capacity of health workers to recognise COVID and also manage infection prevention and control in a clinical setting. India is also playing a leading role in the development of potential vaccine candidates and also producing potential anti-COVID drugs. So overall, India is making a strong contribution on the international phase. Clearly, India is facing a challenge with the disease, but it is focused in particular areas. Our concern at the moment is that the disease, in moving into more rural areas that don't necessarily have the same strength in their health system, that we would see increased spread and potentially increased mortality. The pattern of the disease moving into younger age groups is also felt in India as well. So India, again, being a large, very diverse country, the situation varies across the country. The government is ramping up its response. The frontline health services are being supported, but again, the potential for this disease to spread quickly in overcrowded urban areas and in poorly served rural areas is always there, and India will obviously have to keep up a very strong and sustained effort to both prevent the spread of the disease and to treat those who fall ill.